Explain to people what those work requirements are and why they are really not an effective way to make sure that the right people are getting the care they need, and people who are, like, I think what they're saying is quote unquote poor people are lazy, right? That's the underlying statement of this. Why all of that is so false.
Yeah, so when we have these discussions about work requirements, there's always those who think they're a good idea say we want to encourage people to work. There're going to be exemptions for all of these categories of people. So don't worry. You're not going to be affected if you're older. You're not going to be affected if you have a disability. You're not going to be affected if you're doing what you're supposed to do. But what we have seen time and time again is, first of all, is completely inefficient. The thing is, everyone has to go through this process of proving that they are worthy. And what we've seen in states is the vast majority of people are working, or they're in school, or they fit one of these umpteen categories that they're going to be exempted. But you end up losing way more people than you think that you're going to lose. And the thing is, again, we already have these issues in the healthcare system. Many people, when they come off of Medicaid, lose coverage when they get a raise, what have you, because of paperwork and the transitions. And if anything, we needed to be moving to a system that was making it simpler for people to get coverage, because a lot of times I think we don't understand that it happens, like these transitions between coverage, they happen at very difficult times in your life. And I'm just going to give you one example. Again, I'm a mom, so I have a lot of feelings about some of our, my own experiences. So in our country before the Biden administration, Medicaid covered women postpartum at higher income levels. So often you would lose coverage right around 2 months after you've given birth. You know what's happening to you as a mom 2 months after you've just
Oh,
given birth, right?
yeah.
A lot in your life. And so then you had to figure out, okay, am I eligible for some new program? What is my kid eligible for? All of this stuff. So during the Biden administration, we were able to get almost every single state to extend coverage postpartum for 12 months. So then you don't have that transition.